Hello, my name is Nurse Pauline RN. Welcome to my channel. Today we'll be talking about Exam 2, which is already in your playlist. Today we'll be talking about Exam 2. This is part 2 of Exam 2. Before I get started, please hit your like button. Please subscribe to my channel. Please share this video. Thank you. Today we'll start with questions and answers. My first question: your patient is having difficulty breathing, short of breath. Your patient's oxygen on room air is 85, going down, down, down. Your patient's oxygen is less than 90%. It's in the 80s. Doctors usually order oxygen to be greater than 92% on room air. So your patient's oxygen is getting lower and your patient is in distress. Your doctors order the ABG. What does the ABG stand for? ABG stands for arterial blood gas. And this is a lab test. It's a blood draw. It is drawn by your respiratory therapist most of the times in the hospital. Do you know from which artery blood will be drawn? A ABG is drawn from the radial artery. Your thumb right on the side, that's your radial artery. The respiratory therapist will come and draw your blood, ABG, send it to the lab for testing. What does the ABG measures? ABG measures the amount of oxygen, the amount of CO2 that's in the blood. Your ABG tests for acid-base imbalance. Your call light is turned on and your patient, when you rush to the room, your patient say, "Nurse, nurse, nurse, I pulled out my IV." Patient is on heparin. Patient is on Plavix, maybe aspirin, and there's a lot of blood all over the place. What do you do first? First, you'll apply pressure to the IV site. Remember, when there is bleeding, the first thing you do is apply pressure. Which patients does a doctor usually order parental nutrition, liquid nutrition that's administered in the vein? It's an IV. NG tube, liquid nutrition. GI tube, a gastric tube. Which patients GI tube is for tube feeding? Which patients do the doctors usually order these feedings for? These patients gotta be patients who are NPO, patients who have difficulty swallowing, patients who are unable to swallow, patients who are critically ill, patients who are in the ICU, patients who are on prolonged bowel rest. What are the signs and symptoms of infection? Signs and symptoms of infection: cardinal sign, elevated temperature, sweats, fatigue, chills, patient trembling, elevated WBCs. These are signs and symptoms of infection. What are the signs and symptoms, of wound infection? Signs and symptoms of wound infection includes pus, pain, swelling, redness, malodorous, foul smelling. Which tubes will the doctor order water flushes for? Which tubes will the doctor order water flushes for? Your doctor will order water flushes for your NG tube, your GI, gastrointestinal tube feedings. The doctor will order water flushes before administration and after administration to prevent clogging. Once these tubes are clogged, it's not easy to be resolved immediately when the patient's feeding is due. Please be sensitive. You have to flush your tubes. These tubes includes also patients who are getting tube feedings. Nurses have to crush their medications. The oral medications are crushed and placed in these NG tubes, placed in these GI tubes. So these tubes are at risk for clogging. Patients on NG tube, patients on tube feeding, GI tube, what diet is ordered for these patients? The diet that is ordered is NPO. NPO is a diet order. These patients are ordered tube feeding diet. Who administers your patient is going to Whirlpool, that's in the hospital. Who administers Whirlpool in the hospital? In the hospital, a physical therapist administers Whirlpool. What does your Whirlpool do? Your doctor has ordered a Whirlpool. Whirlpool debrides the wound, debridement of the wound. The Whirlpool is also ordered for burn patients. It removes necrotic debris from wounds. A patient going to Whirlpool, what would be the most important thing to do for your patient before you send your patient off the floor for Whirlpool? The first and most important thing for you to do is to administer pain medication. You have to, because patient will be in serious pain, and you will have to leave the floor and leave your patients to go and administer that pain medicine to your patients, and your patients need pain medications. What is the definition of chronic illness? Chronic illness is a permanent change caused by irreversible alterations in the body. Example, patients with diabetes, patients with COPD. What are your primary level prevention? What is primary level prevention? This is your immunizations and your vaccinations. These are usually administered in the clinics, outpatient clinics. What is your secondary level prevention? Secondary level prevention is usually in the hospitals. Nurses administers medications. Physical therapist gives physical therapy. What is your tertiary level prevention? These are usually done as restorative care, for example, in patients going out of the hospital to rehab, to nursing homes. What is the function of your kidney? Your kidney is responsible for getting rid of waste from the body. Waste products like drugs and toxins through urine. What is a fairly reliable indicator of kidney function? Your answer is the creatinine level. Creatinine level is the fairly reliable indicator of kidney function. Please note your patients who are on hemodialysis, the creatinine level will be elevated. Okay, your patient is not doing well, and you have a very important call to make to the doctor. Please note, you only make a call to the doctor when it's very, very important. Please limit your calls to the doctor. It has to be very important. When you call your doctor, first thing you do, you get the name of your doctor. Write it down, please, always. Let the doctor know the patient's name you're calling about, the room number. Express the situation to the doctor. Your doctor will give you an order over the phone. And do not forget, you always read back to the doctor. You always read back. When you're finished with your communication, do not forget to document your telephone call in your nurse's notes to protect yourself. I called the doctor this day, this time. This was the reason why I called the doctor, and you signed your nurse's notes. Remember, when you telephone your doctor, the abbreviation is TO. The abbreviation for telephone order is TO. If your doctor is in the room or your doctor is at the nursing station and the doctor gives you a face-to-face order for your patients, do not forget the abbreviation is VO, verbal order. And all verbal orders must be written by the nurse. If the doctor is not able to write it, document it in your nursing note that the doctor gave you time, date, patient's room number. This is the order the doctor gave me, sign it. And you write that verbal note, your verbal order, and you leave the verbal order, and the doctor will always come back to sign your verbal order. All telephone orders, all verbal orders that you take from the doctors will be signed by the doctors. Do you know what an objective data is? An objective data is anything the nurse can see. I see jaundice. I see cyanosis. You're using your sight. Objective data is anything you can use your five senses to observe. I smell. Foul smelling odor. I listen to the lungs. I listen to the lungs on auscultation. I can hear wheezes. Anything the nurse or a second nurse standing to you, you can say, Marcia, come here. Listen to the lungs. Do you hear that sound? Anything one nurse or a second nurse can verify with five senses, that is your objective data. What is your subjective data? Your subjective data is self, patient's self, subjective. Anything the patient sees, anything the patient says is subjective. I feel nauseated. I feel as if I want to throw up. If the patient say, I feel pain, that's subjective. Then the patient is the only one who can tell you what the pain is. My pain is dull. My pain is throbbing. My pain on a scale of 0 to 10, my pain is a 5. All those are the data's coming from the patient. That is subjective data. The primary and best source of client data, the answer is always the patient. What is the nurse client's position to facilitate an easy exchange of information during admission? During an admission, the nurse has to develop a trusting relationship with her patient. When you're admitting your patients, you're going to be asking the patient for a lot of information. You will have the patient lie in bed. The nurse will sit on a chair at the bedside so you can have eye-to-eye contact on the same level with the patient, and you will ask your patients these questions. So the position for admission, the patient is lying in bed, the nurse is sitting at the bedside with eye-to-eye contact. Make sure you dim the lights in the room, you turn the television off. Create a quiet environment to facilitate a therapeutic environment. Okay, this is all I have for part 2 of exam 2. Please stay tuned for part 3. Please like, please share, please subscribe. Have a blessed day. Thank you.